Thank you. Um, okay. Hello, everyone. So, in my presentation, I will share with you my journey going from MEPI to a PhD in preventive and social medicine at the University of Antwerp. So, what comes to my mind when I think back about our MEPI? I had a lot of beautiful memories with my classmates. So, in this picture, you can see us exploring Antwerp together. And during our master, we also had a lot of times when we could get together and we exchange the culture from our home country and also the typical food from our home country. And more importantly, the MEPI laid a solid foundation for us. So after our master, we went for PhD in numerous topics. You can see some of them here. So, for example, colorectal cancer screening or genomic epidemiology or cardiovascular diseases or the vaccination programs in Belgium, also current methodology for model validation and assessment of clinical utility. For some of us, we didn't have any background or experiences before we got to these topics. So my message here is if you are interested in a PhD and you see an interesting topic, but you are afraid that you don't have any background or experience in that yet, but I encourage you just go for it. And then once you get a PhD, you will have some time at the start of your PhD to learn about the topic. So in the next few slides, I'm going to share with you more details about my PhD topic. So my topic is on colorectal cancer screening in Flanders. So in Flanders, every individual eligible for the screening program from 50 to 74, they got a fecal a fit test, which is to detect a small amount of blood in the stool. So they got this test for free every 2 years. And after they have this test positive, they go for colonoscopy, which is a flexible tube to examine the colon and rectum and to take a biopsy or to remove polyps if there are any. So the program has many benefits. It helps to detect the early sign of cancer. It reduces mortality. So the fit test reduces mortality by 16%. This test is free of charge. It is sent home via post, so no transportation is needed, and the results and follow-up information are systematically stored. However, it still has some issues like the participation rate in this program is low, only 50%, although the test in the program is free of charge. Some people, they still go for the non-organized test, so they order the test online or they buy the test at the pharmacies, and these tests are not free of charge. And also when they go for a colonoscopy, they can have a certain risk of complications, for example, bleeding, perforation, or death. So this is also the interest of my PhD. The first topic is we want to understand the factors associated with organized and non-organized screening using fit tests. So we have data from 308 municipalities in Flanders from 2015 to 2017. Our outcomes are organized and non-organized screening coverage by fit, and our exposure are socioeconomic, demographic, and health-related factors. And for these variables, we got the data from the provinces.incefus.be website. But for the inside-outside coverage, we have the data from the Center for Cancer Detection. So as you can see here, we need to we get our data from two different data sources. So what I applied in this project from the things I learned from our master is first about proposal writing. Because before we do any research project, we need to convince people that our project is worth doing. And in our master from the first semester, we already have a module called the research project, in which we learn how to write a research proposal. And the second thing I apply in this project is about data management, because we need to make a link between the data from the provinces and the data for the Center for Cancer Detection. So basically the exposures and outcomes, we need to make sure that the data link is performed properly. And in this case, I also use the DAG to identify confounders, because here you can see we have almost 20 variables, and some of them are connected to each other. So that's why we need to use the DAG to identify the confounders. And in this project, we have both the outcomes and exposures repeatedly measured each year. That's why in this case, we use the GE method, the generalized estimating equation, to tackle this matter. The second topic of my PhD project is colonoscopy-related complications in the context of colorectal cancer screening. So as I said earlier, after a person has a positive FIT test, the person goes for colonoscopy, and the person has a certain risk of colonoscopy complication. So as you can see here in the picture, this is the perforation complication. And the problem now in Belgium is that we don't have a central registration of colonoscopies, and the complications are not systematically recorded. However, the people who go for screening, they need to know the information about the possible complications of colonoscopy so that they can make an informed decision about participating in screening. That's why the aims of our study are to describe rates and characteristics of serious colonoscopy-related complications, in this case, bleeding, perforation, and death in the context of colorectal cancer screening. And also, we would like to identify the risk factors associated with the occurrence of these complications. So in this project, we also obtain our data from 3 different data sources: the health insurance data, hospital discharge data, and the data from the Belgian Cancer Registry. Outcome here is colonoscopy-related complications. So for this, we identify the complications based on the procedure to manage complications from the insurance data, and also the diagnosis of complications from the hospital discharge data. For exposure, we have individual related factors, for example, age, gender, socioeconomic status, comorbidities, the use of some medications, which increases the risk of complication. We also have some factors related to colonoscopy itself, like, for example, whether a polyp was detected during the colonoscopy and was removed, about the anesthesia procedure, about the endoscopist experience and specialty. Also, there are factors related to the lesions, like whether a lesion was detected during the colonoscopy, or about the lesion's characteristics. So in this project, what I applied from the things I learned from our master is first also the study proposal writing. The second skill also data management, because in this case, we even have data from 3 different sources. So it's very important to make a correct link between the databases. And in this case, we use a case control study design. So those people with a complication are the cases, and those people without complication are the control. So as we learned from our master, when we study the risk factor related to an outcome, is a proper study design. And in this project, I also learned a new thing, which is authorization, writing an authorization demand. Because here, when we want to link the data from these three data sources, we have to submit a demand to the Data Privacy Committee, and we need to convince them why we need this data, these variables, and whether we can guarantee data privacy in our project. In the last slides, I just want to share with you a few words about the practicalities when you want to go from master to a PhD. So there are several options. The first one is you can apply for a PhD during the last semester. Like for example, in our MEPI, for the last semester, we only focus on our master thesis. So we only have 2 courses in the last semester, and the time is quite flexible. That's why you can use this time to apply for a PhD. Or you can also apply for a PhD after graduation before going back to your home country, because we graduate in June or August, and then we need to return to our home country in October. So there is still some time in between that you can apply for a PhD or a job if you want to focus on your thesis during the last semester. And the third option is you can go back to your home country, work for some time, and apply for a PhD afterwards. In that case, you don't have pressure about time, and you can also go back to visit your family for some time. And then a small point about like in the case you are married and you have your husband or your wife or your child at home, and it's already hard for you to have 2 years far apart from them, and now you want to do a PhD, but you don't know whether it's difficult in that case to bring your family with you. So from my own experience, it's possible. So you need to go to come first to prepare the documents for their visa application, and the application process takes about 3 months. But during that procedure, you will get a lot of support from the HR department. Are you still following?
Yes, I don't see your screen.
We are.
Yeah. So that's all I want to share with you today. And if you have any question, we can discuss further during the group discussion.
Thank you very much, Pam.